Okay, we're going to briefly go over how to prepare a fluid bag for our surgeries. When you get your bag out of the box, the bag, the shelf, wherever you get it, it's going to be stored like this. It's going to have a cap on the end of your little port that you're supposed to inject your administration set into. So this one has a particularly little white cap with a little tab on it. You're going to grab this, pull it off, and what you're going to wind up with is something that looks like this. Your administration set is going to come with a cap over the sharp pointy end. When you remove this cap, you want to make sure that this part stays sterile. So this was just an example so that you could see it. Here is my prepared one for the fluid bag. This is sterile, this is sterile. You must inject one into the other. Sometimes it's a little stiff and you're gonna have to twist a little bit, but just hang on to it. So now I've got my administration set into my fluid bag. I'm going to squeeze this bag, just a little, this little port or bubble right here, and that's gonna start to fill up. You don't want it to fill all the way, because what you're going to need to do, I'm gonna go hang this up over here, is prime your line. So take the end, it's going to have a little cap on it. Unclip your line, open it up so that it all drips. And I will show you how to undo all of that in a minute. Oh, sadly my line is all kinked up. Practice lines or already used lines have an additional kink in them usually from being pressed together so long, and you can see the fluid drip through. Now you know you have a primed line. Make sure you put your cap on the end of this, which I don't have. Sad. Never put it down without some sort of needle on it. Okay. Bag. Administration set is connected to it, line is primed, and your other end is sterile. We're going to go ahead and put that into our fluid pump. This particular fluid pump has a door on the side. You flip it up and you open it up. Fluid pumps have particular lines that you can use with them. This one you must use the green tab with it. There's a little slot right here for it. Slide that down, slide that in. Sometimes it's a little awkward, but follow the channel with it. Push that. Okay, now you can see how it goes in here. Clip is in place and it tells you insert slide clamp here. This side's from the bag. It tells you what to do with it. Secure tubing, this goes down to the patient. Close your door, and now you can turn it on. Okay, and at this point you're gonna set your rate, which we're just gonna set 12. See how that changed? You're gonna set your VTBI, which is volume to be infused. You never wanna set this for more than what your fluid bag is. So ours has 800 mLs in it, so we can actually program it for 800 mLs. And then you can hit start, and then I'm gonna hit stop so that it doesn't leak all over the floor. So when your patient is ready, all you have to do is hit start again.